My joints hurt. I'm not able to move my joints, and every time I ask the reason, I'm told that I've got arthritis. But what exactly is arthritis? I'm asked this question by my patients all the time. Hello, I'm Professor Manish Kiran. I'm a consultant orthopedic surgeon with a specialist interest in your bone and joint health. So, every joint contains at least two bones, the ends of which have a structure called cartilage, and they're meant to be smooth so that they can slide over each other without any pain. In simple terms, arthritis is anything that reduces the smoothness of the cartilage in a joint. There are multiple causes for arthritis. The most common cause is as we grow older, there is more wear and tear, and there are structural changes in the cartilage which results in loss of smoothness of the cartilage, and therefore it results in arthritis called osteoarthritis. It causes pain, loss of function, and difficulty in doing day-to-day activities. But there are other causes of arthritis as well, like inflammatory arthritis. In this case, disorders like rheumatoid arthritis, ankylosing spondylitis can all cause material changes in the joint, and this can result in pain very similar to osteoarthritis. Another common cause is post-traumatic arthritis. So if there's a fracture that either involves the joint or the bone above or below a joint, that can result in a change in the anatomy of the joint, and this can result in changes in the forces that go through the joint, resulting in arthritis. Another common cause is avascular necrosis. That's when the blood supply to the bones of the joint is compromised. So there are over 100 causes, but in short, arthritis is basically loss of smoothness of a joint, which results in pain, loss of function, and difficulty in day-to-day activities. Follow me for more insights into bone and joint problems. Please like, share, and subscribe so that other patients like yourselves who are trying to find answers to their questions find them through these educational videos. Thank you.